The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
The view.
Good evening. I am Errol Schneer, Bronx-Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and also encourage you to continue participating in this HealthBeat program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you, the Bronx community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx-Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx-Lebanon's Vice President and Medical Director, and I will be discussing a new online service that will offer patients the opportunity to always have their access to their information.
Yes, Errol, this service, which is called My Bronx Care, will enable patients to contact their physician or make an appointment, as well as obtain all types of pertinent medical information. Joining us this evening to explain what the Bronx Care service is all about are Dr. Isaac Dapkins and Mr. Dwayne Granson. Dr. Dapkins is Director of Ambulatory Care at Bronx-Lebanon Hospital, and he is a widely accomplished and recognized physician in the field. Mr. Granson serves as the Assistant Coordinator for Bronx Care's Department of Medicine and is an expert in the management information systems.
Now, before we hear from both of our panelists, let me once again encourage you, our viewers, to call in with any comments or questions you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Now, Dr. Dapkins, let me start the program by asking you to provide our viewers with a general overview of what this My Bronx Care service is all about.
Mr. Schneer and Dr. Gums, thank you very much for letting me have an opportunity to talk about this exciting new way for us to help our patients. I think everybody is familiar with the internet, the wide web of the internet. And what Bronx-Lebanon is trying to do is bring the ability for patients to access a patient portal, a way for patients to access their own information. There's a lot of detail, and tonight I hope that we can make it as easy as possible. With me is Mr. Granston. He's been helping me, and he and I will give you the details of this new endeavor.
Now, Mr. Granston, do you have anything you want to add to the overview of what My Bronx Care is all about?
Yes, just to add to Dr. Dapkin's comment, My Bronx Care is essentially a storefront electronically that we've set up for patients to be able to come in and see what services we have to offer and to actually communicate with their primary care physician. So it's really an exciting opportunity for them to be involved in their care.
So it's the wave of the future.
It certainly is.
Okay.
My question is directed to both of you, and it's related to why the Bronx Care service, My Bronx Care service, is important for our patients in the community. Why would I want to look on the computer to get information rather than come in and speak to you?
One of the things that's really fantastic about a patient portal is that it allows a person at home, in the comfort of their own home, to access their provider, whether it be by requesting an appointment, access their health information. They can see actually what medical problems and what the plan is from their doctor's perspective. They can look at their test results. And although this is a new concept, over time it really allows patients to be more involved in their own care.
Right.
Well, it sounds great, but I'll wait.
Do you have something that you want to add, Mr. Granson, to make Dr. Gomes feel more comfortable about it?
I'm not uncomfortable with it. I think it has a lot of interest for some patients and maybe not for others.
Well, one other great feature, I think, is patients will also be able to see their upcoming appointments. So they'll actually be able to know, okay, these are over the next few days or weeks, these are the appointments that I need to make sure that I make it to.
Mm-hmm. Well, when will the service be available for our community, and how can patients actually sign up for it?
So our go-live date is June 1st, and we're trying very hard to hit that date. That date, we will be signing patients up by starting to ask people for their email address.
Right.
An email address is very much like your address to your home, to your apartment. It tells basically a post office how to send information from one place to the next. And so with your unique address,
Right.
we send you through the internet, through an email, a way to sign up for our portal. And once you sign up for our portal, we can help you to sign up. In our practices, we will have people who will help patients understand how to do the sign-up process. We will give you a login and a password. You set the password. And then when you put in the login and you put in the password, you can enter into our digital storefront. You can come in and look around. And when you look around, it will be tailored specifically to you. It will have only your information, and only you will be able to access that information.
Okay. When it comes to computers and the internet, one of the continuing concerns that I always hear about and we always talk about is what about the privacy in terms of My Bronx Care? Can our patients be assured that their information, like you said, is private?
That's a very good question, and it is a very real concern. And like Dr. Dapkins mentioned, all of your information will be password protected by a password that you create, and you'll have the opportunity. There may be one other person that you may designate as a proxy to be able to access the portal on your behalf.
See what happens when you talk about the internet? Okay.
But we assure everyone involved that it is going to be very, very secure. We take privacy and security very seriously.
Okay.
Now, in terms of one of the really terrific features about this My Bronx Care is what you said, the 24-hour ability to make an appointment. Can you describe how that works?
Yes, so I again want to tell people a little bit about the idea of email.
Right.
Most people have probably heard of email before. There's a version of email which is called secure
Right.
health messaging. And so 24 hours, 7 days a week, you can put in your login and password, and if you feel like you would like to come in for an appointment, you can send a secure request for an appointment, and then a live person gets back to you the next business day.
So even at 3 or 4 in the morning, if you happen to wake up and you're not feeling well and you want an appointment, you can do that.
If you're not feeling well, we offer 24/7 live physician response over the telephone. So if you're not feeling well, we'd really like you to call a doctor,
Right.
and you can call our 718-99 Bronx number. And we do offer after hours for our people who have been to our practice, 24 hours, 7 days a week. We offer telephone consultation. But if you have a non-urgent, particularly you want your medications refilled or you'd like to make an appointment, you place what's called a secure message, and that message goes directly, privately to the person that you've asked it to go.
Well, let me just break a little. All of this these plans will be taught to the patients when they come in, or you're expecting them to do this at home? Signing up, I mean.
Well, no, actually, when they come into the clinics, what we'll have soon available will be iPad kiosks. So they'll actually have an opportunity to see it live in person, and it'll be an educational tool. So that it'll actually walk them through the process, and we'll also have registrars and people available to help direct them to how to get to the portal, how to sign up for the portal, and how to use the portal. So that if they come into the clinic, before they leave, they'll have actually gone through it and feel comfortable with it. So they won't just be on their own at home.
Right.
Okay. Now, expanding on Mr. Schneer's question that you probably forgot about, can patients use the My Bronx Care service to actually make their doctor or healthcare provider have specific answers to questions that they can pose anytime during the night, day?
Well, yes, I believe Dr. Daphnis touched on that. They can submit any question they like, and it will go directly, securely to their doctor, and there will be a response from the doctor by the next business day. So the answer
So
is
you're
yes.
also encouraging them not to call you about emergencies, to have
Not
the
to message for emergencies.
Yes,
Right.
So for any kind of symptom, if you're not feeling well and you're not sure, we would encourage you to call the telephone number rather than send the message so that we can get back to you right away.
Certainly.
Okay.
Now, how do patients actually sign up for the My Bronx Care portal? And is it a time-consuming process, or they can do it fairly easy?
Oh, no, not at all. It's very easy. There are two ways to sign up. They can actually come into the clinic, and they can request being signed up for the portal, and we'll send them an email with the registration information. They'll click on a secure link in their email, and that'll take them to the portal where they'll actually need to just verify their email address. Again, this is for security, for their protection. Or they can actually go to the Bronx-Lebanon website where there'll be a link that they can click on. And again, the same process, they'll have to verify.
I'm going to ask you a question, Dr. Dapkins. You're taking our patients to the 21st and a half century. Great. Are we moving too quickly on this?
Well, I want to share with you some of my personal experience.
That's okay.
I have seen great change at our hospital in the last 3 years. We had, 2008 was a rough period of time. During that time, I've seen a lot of change in the way that we take care of people with diabetes. And a lot of it has to do with technology. We have seen dramatic improvement in people's control of their illness when we introduce new technology. An example is an insulin pump. Another example is using electronic prescriptions. It takes time for change to take its effect, but I believe that it's something that we can benefit from.
Okay.
Do you have anything you want to add?
I strongly believe that technology is the wave of the future, and it's the direction we're moving in, and I think it's very advantageous to incorporate into our healthcare system. So I think it'll really benefit patients.
Okay. On that note, let's pause for a short break, and when we return, we will continue our discussion, as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
During this, our year of orthopedics,
What happened with that?
we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at Bronx-Lebanon. Our dedicated surgeons and professional staff offer exceptional services for hip, knee, and shoulder replacements, spine, hand, and foot surgery, trauma care, and sports medicine.
Crucial to orthopedic surgery in the operative process are the anesthesiologists.
The orthopedic surgeons depend on the anesthesiologist to keep their patients safe during the surgery. But most importantly, they rely on us to keep their patients pain-free.
And nurses at Bronx-Lebanon are taking on pivotal roles as key members of the OR team.
Our highly trained staff provides essential assistance to the orthopedic surgeons, as well as specialized care and attention to patients prior to and following their operation.
Surgery can be stressful for elderly patients or those with serious medical problems. These high-risk patients often require follow-up post-operative care in the ICU.
Our critical care physicians, in collaboration with the orthopedic team, are addressing the serious medical problems and the complications that occur following surgery.
In the Women's Health Center, screenings are performed to detect bone problems related to genetic factors and the aging process.
Our GYN team cares for women with osteoporosis for its prevention and treatment.
Many of Bronx-Lebanon's orthopedic patients first come through its emergency room.
Our staff works closely with the orthopedic team to respond immediately to injuries resulting from falls, sports injuries, automobile and bicycle accidents, and other forms of trauma to the extremities and spine.
And Bronx-Lebanon is also leading the way in internal medicine, ear, nose, and throat, surgery, neonatology, ophthalmology, family medicine, pediatrics, radiology, psychiatry, dentistry, pathology, and long-term care. Its Bronx Care Network is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. And before we continue our discussion, we do have a question from one of our viewers. Dr. Gums?
David, thank you for your question, and I'll have Dr. Dapkins answer. The question is, can you log in from a public computer? Dr. Dapkins?
Sure. So thank you for giving us the question. It's definitely a great question. So you can log in from any computer, as long as that computer allows you to put in your username and password. So a good example is a public library does allow public use of their computers, and it is a way that you could access your own personalized health information by logging into our My Bronx Care site.
Right.
Thank you, David, for the question.
It seems like we have another question. Dr. Gums, can you read
We're getting the questions from the Ds tonight. Donna has a question. Can pediatric patients
be enrolled in the My Bronx Care program?
Be enrolled in My Bronx Care? Yeah.
So let me answer this one also.
Sure.
There are some, so Donna, thank you for that question. It's a great question.
Mothers, right?
So there are certain age restrictions on who logs in. So I believe for children under the age of 13, we will offer this service, yes. In the first go around, June 1st, we will be offering it for adults only, though, in the beginning.
But can parents sign up their children for the program?
For their children's for access to their pediatrician, I believe so.
Okay.
Okay. Well, it's a work in progress anyway.
Yes.
Right. Okay. Now
That's
moving
an interesting question.
Now moving to another subject, a question totally different from the questions we've been asking you, is to share with our viewers your own respective backgrounds. And I'll start with you, Dr. Dapkins. In other words, what interested you in the medical field, and why you chose this area of computer medicine as well?
Thank you for the question. My interest stems from having worked in the Bronx for a long time. I worked with a program called Care for the Homeless since I was 18 years old. I'm really interested in bringing good care to my patients. I have a number of people who have a variety of different medical issues, and I like bringing high quality care. So the possibility of bringing technology to assist people in becoming more healthy and making that my job is really a dream come true.
Right. And Mr. Granson, how about sharing some of your background and your interest in the computer field with our viewers?
Sure, thank you for the opportunity to share. I actually have always had a love and a passion for computers, and I've always enjoyed working with them and using them, and so to have the opportunity to use those skills and that knowledge to actually help people, which is something else I'm passionate about. Although I'm not a physician, I can actually use my computer background to help aid in the healthcare of other people. And so that's just a very exciting opportunity.
Excellent. And this is a good field for individuals to go into, the computer field in the medical area?
Oh, definitely, yes.
Okay.
Yes.
Well, we'll do another show on that side.
I'll be back, yes.
Okay.
Returning to the question at hand tonight, what can individuals do when and if they encounter problems when using this service or signing up? We all have problems signing up every now and then.
Yes.
What do you do?
So we
blame you or just?
Sure, well, of course, blame me. We have 2 individuals who will be responding by telephone during working hours to folks who have trouble logging in or who are having problems with the system. And we'll have a dedicated telephone number. I actually don't have that number today. Outside of that, we will also offer email assistance. So if you have a simple issue that you feel comfortable requesting a response via email, you can also send an email asking for assistance.
Well, I don't want to put you on the spot, but you did say sort of working hours. Did you mean that, or what?
Yes, I did mean it. After hours, for assistance, if you leave a message, we'll get back to you the next day.
Okay.
Right. In terms of obtaining medical information, what are the types of things, other than physician referrals and appointments, that the service will also accomplish? You started to mention in terms of drug refills, pharmacy refills. What else can the system do for our patients?
Yes, actually, certain test results will also be available on the patient portal. Not all, but many. So patients will be able to view their lab results through the portal.
And how quickly will they be able to get it?
They, within 3 business days of the information being reviewed by the physician, it will be available.
So that's really a major advantage to the consumer.
Certainly.
Yes.
But I have to ask a question. I get a result of my blood sugar, 300. What do I do at night?
I'm going to take that to represent an amazing opportunity. Think about where we are now. It's a change. It is a change. What do you do with this new information?
Yeah.
So let me just review again exactly what information is going to be in the portal. The portal, it will have appointment information.
Right. Yeah.
What the provider thinks are your allergies. So you can review your own allergies, and if you feel that there's a inaccuracy, you can assist in correcting that. And the health problems.
By writing. Stating something right away.
Or by waiting till you see your provider the next visit.
Okay.
Your medications that are have been prescribed for you.
Yeah.
And select lab and test results, and we're working out exactly how that's going to work.
Yeah.
I think it's important to understand that some of this information will be new for people, for patients. For example, what I think, what you may think is high blood pressure, I may call that something different. And so it's going to open up a dialogue between patients and their physicians or their clinicians. I think that there's going to be a learning curve. And there's a technology learning curve. Some folks don't even really have email accounts and don't have the ability to access this. But we will grow with you, and I think that hopefully in 6 months from now, we'll have really gotten further along, and perhaps in 2 years, we'll be very far along.
Right. Okay.
And I would imagine they would even be able to access this information from their cell phone at some point.
Yes. Our goal is to allow smartphone access by the end of the year, dedicated smartphone access.
Now, this is a question that I need to find out, because I'm sure the patients are thinking about it. Are there any charges associated with using my Bronx Care service? And how would it compare to using a telephone to obtain some similar information?
Well, I love that question because I think that's one of the best things about this service.
It costs money?
Absolutely not. It is absolutely free. And so I think that that's another great benefit, is that it's available to any and everyone who in our network, any one of our patients. And so I just want to encourage people that that's another a great feature. They don't have to worry about any cost.
Okay, and Dr. Dappins, what are the goals that you hope to accomplish with this My Bronx Care portal, both short-term and long-term?
Today the Bronx, tomorrow the world.
So my goals are to get our patients who have diabetes better control of their blood sugar in the long run. So there's a lot of detail in that. So one way is to allow people coming to get their appointments clear. Another one is for them to understand what their medications are. And another one is to begin to really understand what their blood tests mean.
Yeah.
It's a long-term goal, but that's a key piece. We also hope to do that for children with asthma and for certain women's health indicators.
Well, that's good, because I get the feeling that it's all gradual, and I think that makes, I think the patients need to hear that clearly.
And one critical piece, and I'm sorry to steal this away,
no
is
problem.
We need to get people to sign up for it to really take off.
Right.
And I think that
But I think you'll get some.
Yes.
Yeah, because it's exciting. On another note, Bronx-Lebanon is a designated patient-centered medical home. What does this mean to a Bronx community? And how does it tie into your service there, your My Bronx Care service? I think you should take us.
All right, I'll answer this. So
it started before he came.
So patient-centered means we work around you. So the center is not the doctor, not the hospital, but the patient. So we have done a lot of work to try to change and be more accommodating of what patients need. So one example of that is that we have same-day appointments set aside if you call in over the telephone and you want to see your doctor. The second thing that we try to provide, is to try to make sure that you see the same provider next time you come in.
I'm going to bug you again because Errol is nice to you tonight. I want to know, will the patient's wait be longer? You have 10 seconds.
No.
Okay, that's good.
And on that note, let me thank you, our viewers, for joining with Dr. Gums and myself on tonight's HealthBeat television program. And let me thank you, Dr. Dappins and Mr. Granston, for joining with us. And you will continue to be a most important part of our HealthBeat television program.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week when we'll be discussing the problem of chemical dependency and how it's being addressed at Bronx-Lebanon.